And a very warm welcome. You're joining us at Hyde Park tonight. Yesterday in Sri Lanka, we reported the highest number of COVID infections, 1,636. And with the developments in Sri Lanka, we thought of talking to two eminent medical practitioners to talk about the current situation in Sri Lanka and also what remedial measures we can take and how patients should respond to the current situation. I've invited to our studios Dr. Padma Gunaratne, President of the Sri Lanka Medical Association. A very warm welcome to you. And Dr. Harsha Sathischandra, President of the College of Internal Medicines. Thank you very much for joining us. I know this is a very difficult and a busy time for you, but it's also important for us to keep our people informed.
Yes, exactly.
As we talk about yesterday's number, 1,636, the highest reported so far. Of course, in neighboring India, we see a rampant spread and infections and a large number of deaths there, which is very unfortunate. Here in Sri Lanka, yesterday, we reported 11 deaths. And this strain, the UK strain we're talking about, was first reported in Sri Lanka in February, if I'm not mistaken. Although it was found in the UK in September last year. Yes. But after the festive season, Dr. Gunaratne, I think we talk about the rapid spread, the rampant spread of the virus. What is the current situation, apart from the numbers that we get here?
Yeah, actually, the UK variant was detected by the Sri Lanka University, the center that is specialized on studying the variants of this virus, was on 8th of April. Initially, I mean, there were 1 or 2 cases, but then as a cluster, they detected for the first time in 8th of April. And then, as you say, that we had the festive season, and there was so much of shopping, visiting, gatherings, and subsequently we saw this rapidly rising the numbers of cases. So as it is that day by day, sort of we see that steadily escalating numbers, and as the numbers go up, particularly with this particular variant that has more transmissibility, infecting more and more people, and as you get more and more cases, there will be more and more patients with symptoms. Particularly this particular variant is supposed to have more patients with symptoms, more patients becoming more seriously ill and requiring oxygen as well as the intensive care. So that actually the hospitals are sort of getting inundated with the ones with symptoms and the ones who are needing intensive care as well. So it is a time that we all need to be so much alert and to particularly to two sides, for the treatment side, to provide the required treatment, the therapeutics, as well as the measures that need to be implemented for prevention of further spread.
Dr. Sathischandra, I think we are talking about the increased number of cases here, and also Doctor also mentions that the hospitals are inundated. But how is the situation being controlled? More and more patients are being reported, and there is a requirement for quarantine facilities. We know that private centers are also providing quarantine facilities, but what is the state sector response like right now?
Yes, now as Dr. Padma Gunaratne rightly said, the numbers have gone up a lot, and as you said earlier, about 1,600 cases reported yesterday. So, and it's a direct consequence of this new UK variant which is spreading, which has more transmissibility, and as Dr. Padma Gunaratne said, more patients are having symptoms, which we didn't see in the second wave that much. So now we see that patients come to us with symptoms early on in the illness. Previously, we saw actually quite a high percentage of asymptomatic patients.
Right.
But now we do see symptoms in them. So what's happening is whenever a patient tests positive, that information is given by the labs to the Ministry of Health. So the Ministry of Health will take steps to take these patients out of their houses to prevent infections within the household as well as within the neighborhood. to various centers which have various degrees of sophistication. Like we have what we call intermediate care centers with with basic facilities where the patients can be monitored, and when they become little more ill, they are transferred out to hospitals which are designated, and then there are these specialized COVID centers like the IDH, then hospital at Muleriyawa, Colombo East Hospital, then Homagam, and several other hospitals where sort of ultra specialized care can be given to these COVID patients. So it's a thing in transition. Patients are picked up, then they are first admitted to a lower level center, and then they are transferred out. Now, of course, now as I got to know today, I think there are about 11,000 patients currently in our hospital system, 11,000 patients with COVID-19. So they are being treated at various centers. Now, let's say, I mean, some of the centers at a given time may be full now. If you take IDH, for instance, it may be full right now. Maybe, I'm not sure right now.
But what about, Doctor, sorry to interrupt, but we do hear of a lot of patients or suspected cases. I think this is open to both of you. What about them reporting that they do not have a way of securing a hospital bed or even a quarantine facility, whether it be a private center? So what is the situation now? How do we mitigate this?
To touch upon that same thing now, let's say when a patient is tested positive, when a patient tests positive, then the Ministry of Health will give the option for that person, if he is able to be in a private setup, like in a hotel which is designated for that, then that person is given that chance. But of course, the hotels will also soon get filled with people, and then we will have to look for more spaces. And if the person, of course, no person is not sort of, I mean, everyone is given care. So then if that person cannot afford private care, then he is transferred out to a government center. Now, although now actually even in the second wave, we had identified about 12,000, roughly about 12,000 beds in government sector hospitals designated for COVID, right? So right now, I think we are almost at the brink of filling those places. So more hospitals are being opened up each day, and more ICUs are being opened up each day. I got to know that the Karapitiya Teaching Hospital, one of the ICUs was transferred to a COVID ICU about a couple of days ago. So the same thing is happening everywhere. And if a patient, now I think the crucial question is now, if a patient has symptoms, and if that person thinks this could be COVID, he may not be diagnosed yet, but he should go to the nearest hospital. And in that nearest hospital, in each hospital, there is a designated area to keep these patients isolated until the test is done and the result is known. And then if the patient has to be treated there, the patient will be treated there, because actually the Regional Health Services has given out a circular saying that each hospital should be ready to treat COVID patients. So it's not the designated hospitals only. So I think I'd like to speak more on this towards the latter part of the program too, because this is a very important message we need to share with our people. But Dr. Padma Gunaratne, I think I want to once again ask this question about the shortage of beds or care at hospitals, state hospitals specifically. Is there such a shortage, or is there a mechanism to mitigate the situation, if at all?
No, this is, I mean, say if you ask that whether there are beds allocated for COVID, I mean, it would appear as a shortage, but actually what he was trying to say is that the number of beds that had been, I mean, we are talking of two things. One is the ICU beds, the other is the beds allocated for COVID patients, right? So the number that had been allocated for COVID patients was about 11,000 in, I mean, sort of for the whole Sri Lanka. And but then at the same time, that the activities and the sort of by the contributions from our forces, as well as by mobilizing the wards and the staff from other hospitals. There are new centers getting open up every day. So that actually is a dynamic process. That's what we meant. So that there won't be any possibility that there won't be a bed for patients.
Right.
So if once they have come, the hospital would see that, our hospital has to see that if there are no beds, COVID beds in that particular hospital, they have to find a bed for that patient and to transfer to a place where a bed is available. So that system, that sketch is in well existence in the government hospitals in Sri Lanka. I mean, we never send the patient back saying home that no, you have to find your bed. That should not be the case with doctors.
I think we'll take a short commercial break here at Hyde Park and we'll return to speak more. Welcome back. I think Dr. Padma Gunaratne was explaining to us about the current situation. Again, Dr. Harsha Sathischandra, as we speak about whether there is a shortage or not, I think it's also important for us to tell people, as you were mentioning earlier, how they need to report of any suspect case, or if they suspect that they have come into contact with a COVID patient, or if you have tested positive for COVID-19. What is the mechanism here? Should they call NHSL, or should they contact your area PHI? What is the mechanism?
Yes. Now, let's say if a person is already tested and he gets to know that he is positive, he or she gets to know that the report is positive, then there is a mechanism in place. Of course, I mean, that person need not directly inform the ministry, but what will happen is the ministry will get to know from the lab, and the ministry will, through the PHI, inform the person that he or she is positive. So that's the official communication from the ministry, and then they will at some point take the patient out. It may not be immediately within the next 2-3 hours. It may take a little time. The person will be taken out to a treatment center. Right. Now, let's say a person is not tested. A person has the symptoms, as you rightly said. So let me briefly mention the main symptoms that a person could have.
I think we have been speaking about this since last year, but
yes, I
it's
think people
important
must be familiar.
Yes.
Even with the new variant, the symptoms have not changed that much. I mean, the symptoms are that you would get fever, and then lots of body aches, muscle pains, headache, and also a dry cough. And the really sort of worrying symptom is shortness of breath. That is like, I mean, you could be all right at rest, but if you try to sort of say take a few steps, or if you try to do something, if you try to exert, you will feel the tiredness. So, but that will not happen. I think there have been some reports in the media about, suddenly, getting short of breath and becoming very ill.
But
that it would not happen that way. I mean, you would get the initial symptoms, and then if you just follow yourself, I mean, if you concentrate on your symptoms, then you would get to know the point at which you feel more ill, you feel more short of breath.
Right.
So, I mean, you shouldn't wait for that long. And if you have fever, if you have dry cough, if you have body aches, the symptoms of a flu, I mean, in this day, I mean, it's sort of more like to be COVID-19, so you should inform your area PHI. And also there are numbers given by the Health Ministry for you to contact, and they will, once you call, they will answer the call, and they will maybe take you out to safely, because we would not advise the person to go by public transport, because that could lead to spread of the illness. So that person is brought to a testing center, and then the test is done, and he is taken back home until the test result is known. So there is a streamlined mechanism there. Of course, I mean, say once you become positive, it's important for that person to stay at home until the ministry takes the person out to a treatment center. So you should not associate with your neighbors. You should stay indoors. People in the household, I mean, you should sort of keep away from them as far as possible, wear masks, maybe even inside the household. Now, we normally don't ask people to wear masks inside the household, but that may become necessary if a person is thought to be infected and the others are not.
Right. And you mentioned about getting your, if you have symptoms,
yes.
how you should get your COVID-19 PCR test, test done.
Yes.
But then if it is the state sector, how does it work? Do they have to book a test with NHSL or your area hospitals? If you also talk a little about that.
Yeah, so what would happen is, now say if the person comes to hospital because of symptoms, then the hospital will do the PCR.
Okay.
I mean, there's
or
a
they don't
system
have
there.
to book ahead of
They don't
their
have
arrival.
to book ahead. No,
okay.
if the patient is symptomatic, the patient is entitled to come to hospital, and then the PCR is done. Now, say if a patient is not symptomatic but not sort of ill, like, but still having some initial symptoms, and the person is worried about COVID-19, then the person could contact the PHI. So he would take the patient, he would make arrangements with a state sector setup for the PCR test to be done. So the person does not have to actually pay for the PCR test if he cannot afford to. So that is that mechanism is there. So that the PHI would arrange it.
Right. Dr. Padma Gunaratne, I think as we speak more and more about COVID, from January, where the highest daily average of 976 as at then was reported, we saw that before the festive season, we saw a gradual reduction in cases to around 150. But now, again, we see this rapid surge. We cannot also forget about other illnesses, other sicknesses that that people suffered from, who sought immediate medical attention. I think there is a procedure there to take care of those who suffer from other illnesses. But then how do we identify what we need to come to hospital for, and what we should seek, medical, probably at home, where you could support yourself and look into
that's
these?
an important question. And if I could little add bit more to what he said, that once the patient comes to hospital, once the PCR is done, sometimes if the patient is with symptoms, the hospital might admit the patient and might decide to manage, isolate the patient in the hospital. Or if otherwise the hospital decides to send the patient back, it becomes important for that patient to isolate himself until he gets the PCR, because once PCR was done, because that one tend to suspect that person to be suffering COVID, and so that it's important that patient keeps sort of make himself isolated. And with regard to other ailments, it's equally important that as medical professionals that we pay attention for all these other diseases. I mean, some are sort of chronic diseases as well as some are real emergencies. So people have to keep in mind that the hospitals function, all areas in hospitals, particularly with regard to emergencies, all function as usual, so that if there is anything urgent, they immediately have to reach the outpatient departments of hospitals.
Right.
With regard to clinics, of course, that because that now we had experience of how we managed in the past, there were telephone numbers distributed among patients so that they could communicate with their clinics and to get to know that how the individual clinics are being managed. But then, I mean, in general, in all clinics, if they have visited the clinics, all clinics had functioned as usual, and generally they continue to work, I mean, as the way that they used to conduct the clinics.
But I think also, given the current situation, we would try to advise our people to limit their hospital visits. So
yes,
I think what should, in this, I know as medical professionals you cannot identify what illnesses you need to seek attention and not, but in terms of if you have a stroke or a heart attack, let's talk about that. You can still go to hospital, but if it's a common cold, maybe you would associate with home medical remedies.
It becomes very important that to have your family physician, so that one could get in touch with over the phone to your usual doctor and could discuss with regard to the symptoms, and to see that whether a doctor could manage over the phone. And if that possibility, I mean, if that advice is not available, then there's no other option for another to communicate with hospitals.
Right.
And if I may
yes,
add a little thing, now these days we are seeing a rise in the cases of dengue as well. So I think we have to be wary of that. So a person developing fever, of course, the first thing that might come to his mind might be COVID-19, but it could still be dengue. If you have high fever with lots of body aches and headache, eye pain, and if you feel dizzy, if you feel faintish, it could be, and without any signs of a cold or cough or sore throat, then it could very well be dengue. So it's
which also needs immediate medical attention.
Which needs immediate attention. I mean, if that's if it's a case of that, then the person should immediately report to a hospital, and then the hospital would take care. So I think if there are any, as Dr. Padma Gunaratne said, symptoms of a heart attack, symptoms of a stroke, I mean, for those things they should not wait at home. But if it's a mild cold kind of thing, of course they can speak to the GP, or there is a ministry helpline as well. They could speak to that and get advice.
Right. I think it's time we take a short commercial break. We are in conversation with the President of Sri Lanka Medical Association and the President of the College of Internal Medicines. Welcome back. Now we're also talking about the effectiveness or the responsiveness of the vaccines that have been introduced in Sri Lanka. We spoke about the AstraZeneca and then the Chinese vaccine. If we talk a little about that, because there may be some sort of concerns among the public whether you can still come into contact with COVID-19 or whether the first dose or second dose is sufficient. I think this question also needs a lot of clarification and explanation.
Yeah, the vaccine now, I think in Sri Lanka we have mostly administered the AstraZeneca vaccine. I think close to about 1 million doses have been given. And the Sinopharm Chinese vaccine, I think a limited number of doses were given to Chinese nationals. So we have more data about the AstraZeneca vaccine. So if we talk about the AstraZeneca vaccine, the most of the people who have been vaccinated have not got the illness. I mean, they can pick up COVID-19. What is generally said is that even if they do pick up the illness, it will be cleared by the body because of the immune response the body generates through the memory cells created by the vaccination. So, I mean, let's say a person is vaccinated, he comes into contact with a person with COVID-19, he could still get the virus inside the body. It may even, grow in the throat, but it will not cause a bad infection like a pneumonia. It will not lead the person to be admitted to an ICU, and it will not cause death. That is what the vaccine data has shown. In fact, in the UK, they have used it widely. And there is what we call now, there are trial data. Trial data means, when the vaccine, before the vaccine is approved, there are various phases of trials that are done. So those data also didn't show any severe illness. But then they have real world data in the UK after having used millions and millions of doses of the vaccine. And they have said that the rates of hospitalization, ICU admissions, deaths have come down drastically. The same with US and other countries in Europe as well. And the good thing about the vaccine is that this vaccine works well for the UK variant, B117. So I mean, the vaccine will protect people from the virus. Of course, there may be some breakthrough infections, so that is always seen. I mean, there were numbers seen here. Even in the US, it was the same, and in Europe as well. But the main thing is, I mean, our main focus is we will not worry about, a common cold kind of infection or little, bit of flu. But what we want to avoid is getting pneumonia and of course death. So those are prevented very well by this AstraZeneca vaccine. So I think the general message we should give the public is that they should take the vaccination. There have been reports of some rare side effects, but the benefits far outweigh the risk. And currently the healthcare workers are being administered the second dose, and almost all workers are getting the vaccine. So the public should not fear that and should get the vaccine, and it will protect, definitely.
Dr. Padma, I think as we speak about the benefits of the vaccine, it's also important to discuss a little about how we can manage the daily caseload also. We talk about the cases, the highest number of cases being reported yesterday, but going forward, what advice do you also give to the people? We do see that there is, that people have taken the message and they're indoors, but going forward, what strict measures do the medical fraternity advise people to take?
Yeah, what is important at this point of time is that we all have to take our own responsibility to see that we don't contract the disease. I mean, if all have taken precautions to see that we as individuals do not contract the disease, and then we do not communicate, we do not let others getting contracted, then we would see that the infection is under control. So it is by sort of very basic the health, I mean, by adhering to the very basic health guidelines, isn't it? So what is most important is the mask, the facial mask, and as we leave home, it's important that we wear the mask and we remain masked throughout the journey until you come back home. So there's no reason other than for during sort of very short period where you may sort of be having a meal that you need to remove the mask, and even in that type of a situation, it's important that you sit individually and then you have the meal and wear your mask again. So what is most important for us to emphasize again and again to see that we all Sri Lankans wear masks in the community so that we do not contract the disease from others, particularly because now initially we thought it was just a droplet infection. Now the scientifically they have proven beyond doubt that there could be airborne spread as well. So and then the maintaining the distance, the social distance. So I mean, this disease all the time is contracted from another individual. So whenever that we go out, we need to see that we avoid the crowded places. I mean, maybe the fair, the market, or the crowded bus or the train, and then to make use of whatever the provisions that has been provided by the government to work from home and to leave home only for essentials and to go to the nearest close by boutique and to sort of to fulfill the daily needs without moving to the community, and then the frequent hand washing. So these three are the most important precautions that one need to adhere to see that we control the disease as a nation.
We also
one thing, if I may add,
yes, doctor,
is of course if you really don't have to get out of the house, the best thing is to stay indoors. I mean, if you're going out for an economic activity, for your job, that's a different thing. Then we can adopt all the measures that Dr. Padma Gunaratne mentioned. But if in the first place, if we can be at home, that's the best solution. And however much the virus mutates, however much it gets stronger, it uses a simple mechanism to spread, that is from human to human. That does not change, whatever the mutation is. So I think to interrupt the transmission, we have to take the measures, and humans can. So I mean, that's the main message that we have to give. And also, now we talked about the hospitals getting overcrowded and the health systems having to face lots of challenges. So I think, of course, the health system, we have to share a big responsibility in trying to organize services. But the public too has a responsibility to reduce the number of infections. So if they adopt these measures, the number of infections will go down, the need for hospital care will also go down, and our hospital system can be prevented from getting overwhelmed, and the hospital system can be preserved to treat the other illnesses as well. So I think that message we should give to the public as well. I'm sure they know, and it's just a matter of practicing it.
Also about the fact that youth are also, youth seem to come into contact with this virus, and the high tendency of youth infections. If you talk a little about that, because in the previous variant we did not see this. We spoke about risk categories, but youth were nowhere among this risk category.
Yes, I think it could be partly because of these new variants as well, because we say that they are more transmissible, and so because of that, you know, the people who harbor the virus will be secreting it more. In their secretion there'll be a bigger viral load, so it could spread easily. And the younger people are the ones who are active, and they are the people who go out for their jobs, for their other activities. So now they are sort of almost in the firing line, like, because the virus is spreading, it's more infectious, so they are the people who are out on the streets, out in offices and all that. So so that may be a major reason why it's seen more. It's a worldwide observation actually. Even in other countries, youth are getting more infected.
I think it's time we take a short commercial break. We'll return to speak more. Welcome back. I think something that we need to mention is that despite the increase in the recent caseload, Sri Lanka is doing way better than many other countries. I think our COVID control mechanism, our operation has been exemplary, given that the medical fraternity, our healthcare services, as well as the Triforces, they've all come together to assist and in a coordinated effort, if I may say. But as the medical professionals and the fraternity, what advice do you give also to the authorities, and what is the kind of conversation now ongoing? What advice do you have in terms of managing the situation? Because we see the rapid infections being reported, but again, hospitals you're managing, and we require the people also to bear their responsibility in managing themselves. But what advice is given to the higher authorities?
If I could answer that question, Indeewari, there are so much of things that as professional organizations that we could predict with regard to the escalating number of cases and the need to strengthen the laws and the regulations, as well as the needs to restrict the further spread of this deadly infection. But one important fact is to restrict the mobility movement of people. So I think the government stepwise implemented certain steps to restrict the movement of people, but then wherever there is a gathering, particularly we feel that now we see that the bars are open till late in the night. So that's one place that the government could get into, and I think the closed bars, because bars are known to spread the illness. And then luckily the government implemented closing up schools and the universities, and we feel as the SLMA that they need to continue to keep them closed until we achieve some control of this infection. And then with regard to closing up the borders between the districts is another measure that the government could consider implementing. And with regard to taking care of ports of entry, and we need to see that no one enters the country, or at least that we implement very strict regulations with regard to the quarantine process of people that who entered the country. So there are many areas that we need to discuss, because that it involves so much of stakeholders that has to be implemented to achieve the proper control of this infection.
I think this is also, we're talking about the economy, running the economy and managing this situation. While you talk about those, Dr. Gunaratne, Dr. Sathischandra, we talk about several different variants also being reported in Sri Lanka, but not at the extent in which the UK variant is reported. But we are all aware that we have we have an exemplary research team, some voluntarily providing their services. But how far are we working on identifying new variants?
Yes, I mean it's quite a difficult process. So, but I think especially the Sri Lanka Immunology Department has been working very hard under the leadership of Professor Nilika Malavige, Dr. Chandima Jivantara. They've been working very hard, and as you said earlier, there was a Sri Lankan variant, which was the main variant that caused the second wave.
Right.
And then of course we were able to control that, and they did identify that early. And then now we have identified, as was earlier said, on the 8th of April, we got to know about this UK variant being the dominant variant. Actually, that is a dominant variant even in other countries, even in UK, even in the US. That's a dominant variant. So this virus, I mean, once it mutates, and if that virus, the mutated virus, has an advantage in spreading, so it will become the dominant variant very soon. That's a natural process which we can't stop. Probably the only way to stop it is by breaking the chain of transmission. So early on you said about, I think it's important to generate data. So as you said, keep a surveillance on the virus, and also it's important to keep generate data, gather data about the number of infections, and also how many patients become symptomatic early on, how many need say oxygen, ICU care. So that kind of information is important. So the health authorities are actually very busy now trying to generate that information, and that information could be used by the authorities to make decisions on day-to-day decisions. So it's a dynamic situation. So I mean, what is happening today may not be what's going to be there 2-3 days down the line. So we have to be very we have to do surveillance very well. And once that data is generated, there may be certain decisions that we have to take. So as Dr. Padma Gunaratne said, the issue with the bars, and I think the government today has taken a decision to close bars and restaurants in hotels after 10 p.m. So likewise, certain measures will have to be taken based on the case numbers, and also we have to do some prediction models as well. You know, I mean, based on the data that we have, we should be able to sort of say how bad is it likely to get in a week or two's time.
Right.
So that kind of data should also be generated, and that could be used for forward planning.
I think as you mentioned, that what comes to mind is that the UK variant was first reported, confirmed in Sri Lanka on the 8th of February, as you said, as we all reported. But
yeah.
if that was the situation, we report the spread after the festive season, and there was that there was the holiday, the season during the festive season, which we could have avoided too.
Yes, actually 8th of February, I think in February it was in some returnees.
Yes.
I think there was a cricketer who tested positive, so
yes.
it was in returnees.
Yeah.
But in the local community, it was first detected from a Borlasgamuwa construction site on the 8th of April.
8th of April.
What they detected,
April.
8th of April. So what they detected was that when they did the PCR test, a certain gene in that test was not detected. So when that happens, then they suspect, is this a new variant? I mean, they can't confirm that it's a UK variant. Then they have to do a thing called genomic sequencing, which takes about 2-3 weeks. So even if we did know that there was a new there could be a new thing, I mean, we would not be able to tell that immediately. So that's the time period that they took to report on that. So I mean, that's a natural thing which we have to do.
But either way, as citizens, yes, I think it's important everyone stays
that's right. Yes.
Stays safe and ensures that you don't come into contact with this virus. But before we wrap up the show, I think it's important, something I forgot to talk about. We get a lot of calls about pregnant mothers and infants in case they either have the symptoms or are tested positive. I think they would want our medical professionals to speak a little about
yes,
that
certainly.
too.
Yeah. Say if a pregnant person gets symptoms and if she thinks that it could be COVID, or if the person tests positive, there are maternity hospitals where they could directly come over to those. Now, if you take the case of the Soisa Hospital or the Castle Hospital in Colombo and lots of other hospitals, even they need not be specialized maternity hospitals, they could be general hospitals where there are maternity sections. They'll be taken in and admitted, because each hospital now has an isolation ward. So whoever comes through, if there's a suspicion of COVID-19, that pregnant mother is isolated, and then the test is done, the treatment is given, and of course it's the same with children. I mean, if they do get the symptoms, they should go to the nearest hospital, and then each hospital has a pediatric section, so they'll be taken care of. And one more thing I need to add is that, I mean, even though there are designated COVID hospitals but lots of patients are still being treated outside of those COVID designated hospitals. Those patients get the same treatment that they do get in the COVID centers, because we have guidelines, and these guidelines are disseminated to all doctors, so all doctors know how to treat COVID-19. So I think the public should not fear that, even if they are not at IDH, if they are at, let's say, at a base hospital, the same treatment will be given to that patient until the transfer is done. So that message we have to give the public, and I think the public, I know it's a situation where the public could panic because of the rising numbers and the reports of deaths and so on, but they should stay calm and abide by all the health precautions that are given, and then if they do unfortunately get the illness, they should not fear. they should come to the hospitals and they'll be taken care of.
Right. I think very quickly, Dr. Padma, you may have something to add too. Also a question I have, you spoke about panic. Managing stress and anxiety in times as these is also important for those at home and those who are out and about, who are worried about the virus and how whether they might come into contact with it.
Yeah, I think that that's an important area that we need to address, because that there is so much of myths among us. So it's very important that we address myths, and I mean this step that you and I are taking is to clear doubts of people and to educate people. So if one knows what we are dealing with, I mean it's by education that we could handle the stress as well. So one need to have an understanding that we do implement everything on a scientific basis, and that it is a virus infection but nothing else, and it's like cough and cold, but then this has a sort of more disastrous consequences. That's why we need to pay more attention. So I don't think that people need to become anxious or fearful, but it's just a matter of cooperating with each other. And if by chance that if you contract the illness, I mean majority still recover, and it's very few unfortunate that who would end up with complications. So that what is important is that to cooperate each other and to sort of adhere to what had been mentioned by the Ministry of Health and the health guidelines.
Thank you very much, Dr. Padma Gunaratne and Dr. Harsha Sathischandra, for joining us tonight at Hyde Park. I think if there's one thing that we've learned about this virus, it's that we cannot be too complacent, regardless of how good of an effort or mechanism we have here in Sri Lanka. So it's very important that we take responsibility and act responsibly and ensure that we don't contribute to its spread. We had with us Dr. Padma Gunaratne, President of the Sri Lanka Medical Association, joining us, as well as Dr. Harsha Sathischandra, President of the College of Internal Medicines. Thank you very much for taking time off your busy schedules to be here.
Thank you very much.
Thank you very much for watching, and thank you very much for joining us. Please do stay safe.